That Ernest Hemingway, famous author of the book The Old Man and the Sea, had hereditary hemochromatosis.
What's that?
Let me tell you. Hereditary hemochromatosis is a genetic disorder that causes an accumulation of excess iron in the body. Now, this can damage vital organs such as your liver. As you can see here, this is what a normal liver is supposed to look like. When you see microscopically, this is an adequate amount of iron. Now, when an individual who has hereditary hemochromatosis, when you zoom in into their liver, they have an excess amount of iron. This is too much. This disease takes form in 4 different types, catalyzed by 4 different mutations. Type 1 is caused by mutation in the HFE gene, type 2 by mutation in the HAMP gene, type 3 by mutation in the TFR2 gene, and type 4 by mutation in the HSLC40A1 gene. All of these mutated genes affect hepcidin's production just to slow and control the absorption of iron in the body. Now, these genes either serve as a co-receptor in the signal transduction pathway for hepcidin, or even encodes the hormone itself. Therefore, when these genes are mutated, it changes the function of hepcidin, thus causing an uncontrolled iron absorption in the body. For example, in the type 1 mutation that affects the HFE gene, which is the most common type of mutation causing hereditary hemochromatosis, this is when the cysteine bond is substituted for the tyrosine bond, which disrupts a critical disulfide bond that is needed for protein folding. Now, once the HFE gene is misfolded, this causes hepcidin to not be produced enough. Therefore, iron cannot be regulated in the body. Now, how do you even get the disorder in the first place? This disorder is a genetic disorder that is inherited autosomal recessively, meaning that you must have both copies of the mutated gene in order to get the disorder. Now, this typically occurs when 2 parents are carriers of the gene, meaning that they each have 1 mutated gene, but not 2. Now, this is when they then pass it on to their offspring, who now has both mutated copies of the gene, meaning that they have this disorder. If you are feeling symptoms of fatigue, weight loss, or joint pain, and you think you may have hereditary hemochromatosis, you can go to your doctor and get some blood work done to see how high your iron levels are, and then you could get genetic testing done to see if there are any mutations in your HFE gene. Treatments include routinely getting phlebotomies done in order to remove the blood from your circulatory system and lessen the amount of iron. Now you know all about hereditary hemochromatosis. Thank you for tuning in.